So this one's a little bit younger, newly diagnosed with pre-diabetes. So again, some of the statistics on that, why we talking about this is it's the patient population. So we've got over 50% of the US adult population that is at least pre-diabetic. We have over between, depending on the demographic, between 1 and 2/3 have a high BMI that puts them in the overweight and obesity category. And so there's a lot of people out there that potentially do this. And I'm always a fan of like being more proactive, but in any event, this person actually does have a complaint that's associated with a neuropathy problem. And they are in fact being managed for it. They are in fact also on metformin. So very similar, clinical evaluation that we would do for the monofilament vibration reflexes. And again, I have a gait process that is just part of my intake for every patient, not just these particular patients. So again, we're looking at trying to rule out all those other problems to make sure that we are in fact diagnosing them with what we're supposed to be treating with them. So this was 2 times a week, so a little bit younger patient. My biggest concern for this patient is even at 57, just the lack of physical activity, the lack of motivation, dietary intake, all of those factors, and succumbing to 2 times a week it was a challenge because I wanted 3 times a week. In fact, I wanted 4 times a week, but it was a challenge there, but we got to it. So a bit of a similar process, but as we started to taper, we went back to using Shockwave 1 times a week, and that's where the literature really is anyway. And when that happens, and that actually fits into some other clinical models, when you're doing that taper, but when that happens, you can be more aggressive. And actually, I show patients that where we started off here at say 60 millijoules, now we're up to 90. And the reason that that's actually beneficial in their mind and in mine is their threshold of discomfort changes, right? And so when they can withstand more energy, that's actually a really positive factor, not just within the neuropathy piece, but within some of these folks anyway. We did initially start off every day. They weren't compliant. And here's the problem. And I had very few patients that would overcome this, but in general, if you tell people to do 10 things at home and they can't do all 10, it's not like they choose the top 3 or 4. They do zero because it's this failure implication. So that's why we're very careful in making sure that we match that up. Although I had a patient come in, it was a young guy, he was an athlete, and it was at the university clinic, and he came in and I said, yeah, why don't you go ahead and do your exercises, and then, we'll get into some of the other stuff later. Like, I didn't see the guy for an hour. And I went to look for him and I found him, and he's there doing these exercises. I'm like, where'd you go? He's like, I didn't go anywhere. And I look at his, like, what they would do in rehab is they just kept adding to. So he was doing his remedial exercises and just did a whole hour of like all these things. But again, that's not usual. And so unfortunately, we do have to kind of play around a little bit. And I'm not as much of a hard ass as maybe I put myself out there to be. But so we had to comply with this. We had to figure out a way that they would comply to this. And it did work out well. So again, the conservative management. But I will say that they were really good with their at-home compliance, doing the exercises and the things that they were supposed to do. And that's why, again, I was a little bit more lenient at 6 weeks because we saw a lot of that reduction. Now I give people the option. I don't push too hard. I kind of leave it up to people, monthly, quarterly, whatever that might look like to you, depending on what else they're doing.